Warning disclaimer. The content in this video might cause triggers. Please seek help immediately if needed. Additionally, nothing in this video shall be taken as medical, clinical, or legal advice. If you need said services, please seek a professional in your area. Everything discussed in this video is for educational and information purposes only.
Alrighty, me familiar. Welcome to the One Moment podcast. We will be discussing suicide awareness today. You have myself, Kevin Odom. I am a licensed clinical mental health counselor, a licensed clinical addiction specialist, and a certified clinical supervisor in the state of North Carolina. Mr. Rubin?
My name is Ruben Burney. I'm a certified alcohol and drug counselor. I say more than anything, I'm a 68 years old senior citizen who was on a journey of life and trying to learn. And I think this podcast is just another avenue for me to grow with the audience and learn and get to know people. But yeah, I've been in the field 25 years. Got my start in New York in 1997. Worked at various places. About 13 years ago, I moved back to my home state of North Carolina. Not my hometown, but I moved to my home state. I live in a town called Southern Pines, and I've been working in a clinic in Pinehurst about this March, actually, March the 19th will be 13 years. And as a human being, I just living life, experiencing life, and hopefully growing wiser and wisdom.
And I'm very fortunate to be a participant in this podcast with One Moment podcast and have the good sponsorship that we have and to establish new avenues down this journey of the road of happy destiny, as just explained by my friend Ruben, that we like to grow in our wisdom and we like to share that experience and our knowledge with others who may be in trouble with dealing with all these issues with mental health awareness and other disabilities that are crippling our society, to be compatible in a sense of working together to be better human beings. My name is Trevor Zylstra, and I'm a former correctional officer at a mental facility in the state of Colorado and within the parameters of corrections for 7 years, with that experience and just regular lifetime at the capability of learning and new wisdom and beneficial to others. And I just am privileged and humbly grateful for being part of this podcast. Thank you. So because it is we are going to be talking about a very touchy and hot subject, something that I think we all think, right, is very critical, very important, and touches many lives, almost like or very similar to the opioid epidemic. A video I'd like to play to really get us started really well. This is a video for anybody who's watching. This is a video. I actually wrote the article to it. It's a little short video. I don't know how long it is, but wrote this article. Zirkles turned it into a video format for us. But I really think it speaks volumes, especially for the subject of suicide.
Might think. New research reveals challenging the old belief that it's solely due to depression. When people are suicidal, they often believe they are a burden and that their absence would relieve others. They might see suicide as a solution to their overwhelming problems, feeling lost and unloved. But ancient wisdom, like that from the Bhagavad Gita, teaches us to...
So, why suicide? Ruben, why did we choose a topic to talk about suicide today? That's what I'd like to know. Yeah, I'm putting you on the spot.
You are. You know, when Kevin first mentioned doing a podcast on suicide awareness, I was somewhat reluctant because I said to him, I'm not an expert, but then who is? Think as a counselor, a drug counselor, I've worked with people who were suicidal ideation. Unfortunately, I've had clients or patients who succeeded, unfortunately, in, I don't like to use the word committing suicide. I don't like to use that word because it sounds like a crime, who died by suicide. And I think I was uncomfortable years ago. And concern I had to Kevin, I said, look, I don't know all the statistics, but I can tell my viewpoints, my working with people who are suicidal. I haven't worked in New York, I worked at a hospital-based clinic. So I had the opportunity to work in the psychic behavior care unit at the hospital at Long Beach Medical Center. I worked on the patient floors, and I had the opportunity every week to facilitate a group with patients in the behavioral health unit and got an understanding of mental illness and the despair with suicide. So sometimes in the past it might have been a taboo subject, but as I've been a counselor 25 years, I'm more comfortable. I'm not afraid to ask a patient, are they suicidal, thinking that if I ask them that, it's going to put the thought in their mind. So I'll check in with a patient who has a history of that. So I'll check in. So yes, I'm not good with statistics and what have you, but I thought it was something that needed to be addressed as a part of mental awareness. So definitely that's why we came up with this topic. Was that good enough for you, Kim?
Absolutely, my friend. Thank you. And when we talk about stats, well, Mr. Trevor, let me jump to you. You're a former corrections officer, right? So tell me kind of briefly, like Mr. Rubin just did, like, how come talk about suicide? We can't hear you. That's because you were muted. You're muted, my friend.
I apologize. Can you hear me now?
Yes. Yes.
I didn't mean to distract anybody. It's very important to remember that when especially given a set of circumstances that you have placed yourself into, unfortunately at times, and it can be either in corrections or not in corrections, but when in corrections and you're in that state of you're fighting for your survival on a momentarily basis, just like this podcast is stated as being as one moment at a time, sometimes those dangerous situations that you don't really want to be in, you have to somehow come to grip with the capability of being able to understand that because of the decisions that you have made may have put you there. So you have to accept so many avenues of what your next step of survival is going to be. And it's overwhelmingly a burden on those who are incarcerated because they're fighting for their survival one moment at a time. It's a very, very touchy situation because they're fighting for their lives, but how can they develop the strength to go on? It's a very, very touchy situation there. I've seen it in dramatic fashion where things are not good. People want to get out of there and they cannot. And so they think that by removing themselves from the situation physically and spiritually, that's going to solve the problems, but it's not. It hurts their families. It hurts their friends and their loved ones. Maybe their counseling that they're having to deal with, the facility people that have to maybe remove their devices that they use to take care of everything. It's a horrible, horrible way to go. And I've experienced situations where we've had to do that exact thing I'm describing right now. And it's very disturbing to everyone involved.
I hear what Trevor said, and being a corrections officer, I was looking at one of the risk factors, and they were saying that everybody has some risk, but there's certain groups that have more so of a risk. And on this, I was looking at, they said incarcerated individuals that have been incarcerated for years. And I've never been incarcerated long-term like that. But one of the things I just try to put myself in that person's place. When you're incarcerated.
How about short term?
I ain't going. When you're a person that's incarcerated and you got 10 or 20 years and you're in a violent environment, I couldn't imagine how that has to be. And sometimes feeling that despair that maybe that's the only way out. I don't want it in my life, but at the same time, I don't want to continue in this environment. I can empathize with an individual going through that. It must be a horrible situation to be in. I know a former coworker of mine talked about her son is incarcerated for a long period, and the despair that he experiences, in that situation, you're around people who, some are very violent, and you have to deal with that daily. I'm not a fighter. I'm a 68 years old man, old now. If I were in the prison, I don't know. I'm not a fighter. I'm not that. I'm just a easygoing, mild-mannered young man. So I could imagine, on a serious note, being in that situation, incarcerated that many years.
Yeah. No, and there are a lot of, and I want to definitely start off with the stats. But first, let's talk about a couple of our sponsors here a little bit. The first one we have is Dubby. Go ahead, Ruben, carry it off.
Okay. It's D-U-B-B-Y, Dubby. It says Dubby Products itself is on 100% full transparency ingredients disclosure. We're packed with 10 awesome ingredients to help keep you on top of your game. Whole coffee extract formulated neurofactor, a patented natural ingredient derived from the fruit of the coffee Arabica plant. It enhances the production of a power protein in the brain called derived neurotropic factor. In a clinical study, neurofactor increased BDNF by 143%. Caffeine, which is derived from the seed of the coffee plant. Caffeine increases alertness, focus, and energy. It has L-tyrosine, an amino acid that is an essential component for production of important brain chemicals. And it has a host of other ingredients. And one of the important facts, it says, unlike some of the energy drinks out there, it doesn't give you that crash effect. So it's D-U-B-B-Y.
Thank you, Mr. Rubin. I do appreciate it. Then we have WebHash, and I'm fixing to show y'all the website. They are another sponsor of ours. So everything that our whole website, we have two of them. Both of them are built using the WebHash platform. It is a no-code decentralization Web3 platform. They have everything that you need for your website. You can get started today. All you have to do is connect your Web3 decentralized or centralized wallet, Coinbase, MetaMask. They have a couple of different options as far as, paying for it. They have a lifetime subscription, 0.3 ETH. They have a pro prescription, $71.88 free plan. And then, the one thing I like about WebHash is most websites, as far as buying storage, you're going to pay $15 to $20 gigabyte of storage every time you use up your space or use up your storage. What I like about WebHash is they are selling 1 gigabyte of storage at $4.99. They have stood behind the one moment movement since the beginning. So again, WebHash, you go to webhash.com, and if you want a website that is tokenized and put into an NFT, definitely check WebHash out. They are absolutely phenomenal. And Trevor, you are sideways, my friend. Yeah, now there you back.
Just bear with us. But Trevor is more technology driven than I am, but you have to bear, all this is new for me,
Yeah. So that actually shows us one thing, because once you start up Riverside, you can't change anything.
Yes.
That actually, I'm learning, because I went to go plug my mic up. For some reason, my microphone ain't working. Don't know why, but I was playing with it as you were talking, Ruben, and you cannot change from one microphone to another. So it's one thing I noticed. All right. And let's talk about Miss Sierra Suros. Go ahead and tell us about her.
Oh, me?
Yeah, go ahead.
I don't have her. Well, I can tell you just personal experience. Her facility is called the Healing Place. Am I right?
Yep. No, the Place to Heal. I'm sorry.
I'm sorry. forgive me, that Place to Heal. And she has provided the opportunity for us to meet there, like at least bi-weekly, twice a month, to actually do the podcast live. Her physically, it's a beautiful setting. It's conducive. It's a therapeutic environment. Sierra, I've known for at least 5 years. At one point, she was the clinical manager at the facility that I'm now in, and I learned a lot from her. She's a very compassionate individual, cares a lot. I could go on and say a lot about, you call her Miss Sierra, and I call her Sierra. I can go on and on about her. Excellent therapist. They provide a lot of opportunities for women and just in general, individuals in the community. So again, it's the Place to Heal. And I think they have a few facilities as well throughout North Carolina.
Yeah.
So,
Well, let's take a look at what we have for her. Are you ready for it?
Yes.
I'll put this together today too.
Okay. Great. I like that.
Thank you. Thank you. So
That does her justice. I mean, I was going from a personal side, but it really does her justice. Definitely.
Yeah. No, for sure. So we were talking about, I know you said she wanted to hear some stats. And I'm gonna just read off some stats here. Might not share my screen. If I do, then I will. But this is from the International Association for Suicide Prevention. It states that an estimated 703,000 people die by suicide worldwide each year. Over 1 in every 100 deaths, or 1.3% in 2019, were the result of suicide. The global suicide rate is over twice as high among men than women. Over half, 58%, of all deaths by suicide occur before the age of 50 years of age. Suicide occurs across all regions in the world. However, over 3/4, or 77%, of global suicides in 2019 occurred in low and middle income countries. An individual suffering with depression is 20 times more likely to die by suicide than someone without the disorder. And then it says suicide remains illegal in over 20 countries, while people who engage in suicidal behavior may be punished in some countries that follow Sharia law, involving legal penalties that range from a small fine or short prison sentence to life imprisonment. We got some more statistics. Says, this is more specifically for the U.S., right? Says suicide is the 11th leading cause of death in the U.S. In 2022, 49,476 Americans died by suicide. In 2022, there was an estimated 1.6 million suicidal attempts. And then one of the most recent statistics, because that was 2022, says in 2024, the United States witnessed a significant rise in suicide rates, reaching levels not seen since 1941, according to the USN. The age-adjusted suicide rate rose to 14.7 deaths per 100,000 individuals, surpassing 2022 rate of 14.2. This marks a concerning 30% increase over the past 2 decades. Notably, the number of suicide deaths in 2024 exceeded 49,300, indicating a persistent upward trend. Although detailed figures for 2024 are not yet available, but are estimated at 14.7, ongoing trends suggest similar or potentially higher rates, underscoring the persistent mental health challenges. Now, let's back up a little bit, okay? This is a very interesting statistic here. From 2002 to 2018, the suicide rate increased 30%, from 10.9 deaths per 100,000 to 14.2. The rise marks a 30% increase from the rate of 10.9 per 100,000 in 2002 and follows a 5% drop that occurred between 2018 and 2020. And we're looking at just whether it's globally or nationally, in the U.S., like, man,
I'm not going to try to tell my whole story here, but even, I am a suicide attempt survivor. Mine was medication induced, and I'm grateful for that. Nobody knew that that was going to happen. My provider didn't know. None of that. Nobody knew, you know, and it's concerning to me when I look at those numbers, because we can look at suicide rates and we can look at fentanyl use, right? And deaths by fentanyl use is, 190 something people a day just from fentanyl overdoses. So yeah, I mean, it's very concerning and sad. It really is.
I appreciate you sharing that, what you just shared a moment. Not want to brush over that because that helps. The more open we are about it, it helps remove the stigma about suicide. Because, before I became a counselor and younger in my teen years, like 18 or something, when I hear somebody commit I like to use the word commit suicide, die by suicide, I would think, what, are they crazy? Growing wiser and being a counselor over 25 years, I talk to patients, clients who experienced suicidal ideation or had attempts, and you learn, you gain an understanding, as opposed to just saying, oh, they're crazy. You gain an understanding. I think that helps to helps gradually dismantle the stigma about suicide or mental illness in general. I appreciate you sharing that. Yeah.
I appreciate it, buddy. Thank you.
To expound a little bit, I don't mean to jump in here, but to expound a little bit on this life-changing for those around you, somehow you have to be able to recognize and realize the desperation of the situation that this individual may be in, and because of a personal experience, not my own, but it was someone who I looked up to in a very strong way from an early childhood beginning. I had a life-changing placement in my life, and when I got down there, this person was supposed to help me to establish a new start in my own life. That was in 2000. And within 2 weeks that I was down there, after the people that had dropped me off down there, it was dramatic, extremely dramatic, in the sense I looked up to this individual and I respected him and trusted him to such a point where I got this new start, and then I was deceived into the idea that he was going somewhere, but I didn't recognize the symptomatic things that he was doing that were leading down the road to me actually finding him, a family member, a person I looked up to as a family member, that this happened. And I discovered his being after the fact. And I was completely oblivious to it. I had no idea. So bringing attention to people's behavior and their things that they say, the things that they do, are very important to try to cue in on what could possibly happen. You never know what a person is going through mentally to get them to the point where they want to really do something so dramatically negative to everyone's life that they're involved in.
Well, I think it's, not just for clinicians, right? Because Ruben, you said it best, right? Fresh out of grad school, I did not feel comfortable, talking about suicide with clients, because it's a scary subject. It is. And even today, there's, I'm going to share some more statistics with you. There's many, many things of, reasons why, people don't talk to their providers about suicide, or suicidal ideations. I think the last time I read that statistic, it was over 20% of patients do not discuss it out of fear, and fear of many things: fear of rejection from family, fear of rejection, social rejection, fear of being forced to remain in a hospital setting, or to attend a hospital setting, such as the I know some states call it the involuntary commitment process. I don't know about other countries or what they call that. Of course, we just read that suicidal behaviors is criminalized in many countries, and I am baffled by that to even read about that. I don't know which countries there is because it didn't break that list down. So when we look at these numbers and stuff, I think it's important to recognize some of the warning signs. Now, this isn't a comprehensive list that we're going to be reading out. Uh, but Ruben, would you like to touch on some of the warning signs that we were talking about last night? And then I know that your list is a little bit different than mine. So let's start with you. Then I'm going to jump back on the warning signs. That Trevor will jump to you.
They say some of the warning signs are, for example, when an individual starts, you see erratic behavior or a lot of risk-taking behavior. Another warning sign, I know as a therapist, or just beyond that, when people used to talk about, they used to say, when a person talks about suicide, don't believe them. You have to watch the ones that don't talk about it. But I find, they say that's one of the warning signs when a person is, I can't think of the word, when a person's preoccupied with death or what have you. I might see that talks about death a lot. That could be one of the warning signs. A person starts to give away some of their possessions, or you might see a person who might start to clean up their environment, or there's so many risk factors out there. Well, I would say risk factors different from warning signs. There's so many warning signs that are out there.
No, you're right. Thank you for starting that off and sharing some of that with us. And I'm gonna just read over some additional stuff because I know you and I have different resources, so I think it's important to look at various resources, right? But as you said, they are showing erratic behavior. They're talking about death. They're talking about suicide. They might even experience feelings of or express feelings of hopelessness or being trapped. There might be some social withdrawal, whether it's from family or friends. Another one is, and this is a huge one, I think a lot of people, or I shouldn't say a lot of people, but I think people don't realize is a warning sign, but it's giving away possessions.
Yes.
Or putting affairs in order, right?
Yes.
Another warning sign is when you say erratic behavior, it says also, I think we should throw in there some, use of alcohol and drugs. That is also a warning sign. Risky or self-destructive behaviors, maybe speeding down the highway with no care in the world, right? Or with an intent to, die by suicide or harm oneself. There's many ways to engage in self-destructive behavior, and that's just an example. And then another one that you and I were talking about last night, Ruben, was having a sudden improvement after a period of depression, which can indicate a final decision to end one's life or die by suicide. And so there's a lot of things. And again, I want to emphasize, right, that it is my personal opinion, not my clinical opinion, right, that there is so much research that needs to be done on warning signs of suicide that that's not a complete list that we were just reading over. There's, probably, and I would guarantee it, much more warning signs than what we just read over.
Mm-hmm. They said depression or any type of mental illness like anxiety as well, a person experiences that. I'm not saying everybody who experiences anxiety or depression is going to die by suicide, but that is a factor. You shared something personal. I know I've shared, you like to use the word suffer from anxiety. I don't like to use the word suffer because I think a lot of people have anxiety. I live with anxiety and I learned to manage it and, through medication and what have you. And I find that there was a time in my life where, like, for example, I think I shared this before. When I was 18 when I moved to New York, and I was more resilient. And although it was a culture shock in the beginning, I adjusted fairly quickly. I got a job, made friends, and stayed there 40 years. And I really enjoyed living in New York. I mean, when we got ready to move here, I think I was reluctant at first. We moved here about 13 years ago, and I remember when we moved here, I was going through anxiety. I had problems sleeping. I think I I was in a sense of despair. I was in a new job that in the beginning, people who knew me will tell you I complained about I hated the job. I hated living in North Carolina. I wanted to move back to New York. I was going through severe anxiety because I was lucky if I slept 2 hours a night. And I remember just going through despair, and my wife was very supportive, but who wants to be around a person who constantly, I didn't eat. Probably lost about 30 pounds. Finally, I decided, I can't go on like this. So I went to a doctor. They put me on medications. One of the things being a counselor, I knew that I had to work through that anxiety, through exposing myself to it. So I became more comfortable with technology, all that. And, over time, now 13 years later, I worked through that anxiety, but I still experience times of anxiety, maybe a couple times a year, whether it's really intense. But, I'm not ashamed of that. I learned to manage it. I meditate. I learned to work through that anxiety. So I don't like to use the word I suffer from anxiety. I live with anxiety. But because I live with anxiety, I'm more focused on my mental health. And I tell my patients, if I was to go in a hospital for an injury or some illness, you know what, there would be no stigma. But then if I needed to go in a hospital or behavioral care unit to manage my anxiety or to get on medication, I really see no difference. I'm a spiritual, mental. We're all composed of all those components of ourselves, and you have to address that. So I see no harm in talking about spirituality, in my emotional, mental health, as well as my physical health. All those things are important to me. So I'll definitely address that and share that. Yeah, I'm on medication now that I take once a day, and it really helps to manage the anxiety. And anybody that takes me around me, I'm a happy person. I'm very happy. But there are times when I have the anxiety becomes unmanageable. Sure.
So my understanding of what Ruben was just talking about totally encompasses every situation in a human being's life that they could either positively or negatively, like the old days, they used to have these green screens with a graph on the screen and a line through the middle with a wave going across it like a heartbeat. So your ups and downs of an emotional, psychological, mental state have to be balanced out in such a way to give you the positive reinforcement in your own self to keep going through these difficult things that may happen. Some people get overwhelmed with a simple thing. Other people get involved or overwhelmed with a serious, dramatic thing that they can't seem to mentally handle. And getting away from it or out of the existence seems to be the only answer that they can come up with to solve the problem of their situation. So adapting an emotional and spiritual foundation as the base to rely on, it seems to me to be the only really recourse for the positive development into your mental state to keep you with the energy for that going. It could be something as simple as looking at a beautiful sky. Maybe it could be a pet. Maybe it could be making a point of contact with a friend or a family member that you love. These things can go from momentarily happenstance, or it can be to a long-term development. You just never know. There are no boundaries for the ideation of this thing to jump into your life and for you to grasp a hold of it and think that that's going to be an answer somehow. It is an overwhelming problem with the world. It scares the heck out of me for me to understand or even think that other countries have developed a criminal consequence of wanting to remove yourself from the equation. So it's very disturbing to me that there are countries that would criminalize that. So if you try to take your own life, remove yourself from the equation of life, and then to get criminalized by that, that's very disturbing to me.
Yeah.
Now you see, now y'all see why Okay. When we were talking the other night to get a little bit more personal with our audience, right? Some of the things that why it makes sense to have a global, really to achieve a global impact on mental health. I mean, this is probably far from a long shot, but whatever countries their, suicide or suicidal behaviors is criminalized in, hopefully we can be that, fuel for change. Hopefully we can be able to change this, change and get it decriminalized because think about how many lives we could save. We were talking about the other day, and I got to play one of the advertisements that we have for one of our sponsors, but think about, the other day we were talking when, with Miss Kim, right, during that episode, and we were talking about the critical issue of, the Oklahoma, in the state of Oklahoma, where they were proposing to move everything from the mental health department of services over to,
Department of Correction.
to the Department of Corrections. Well, we
Completely
talked about,
department, by the way, that abolishing it.
yeah. Yeah. And so we spoke about
Ability onto
us, some of the problems that, that could occur because of that, with people not seeking help, right? People not seeking treatment. And so when I think about, or when I hear about the criminalization of suicidal behaviors, that's concerning to me too, because how many people are afraid to seek help and talk about what's going through their head, right? And for that, we got to take a hard cut real quick and for one of our...
Does anyone else subscribe to their social media channels for more information?
Well, yeah. I mean, when we think about the warning signs and especially the criminalization of suicidal behaviors, man, that's from a clinical perspective. That is so concerning for me.
Sure.
Think about if we had something like that in not just North Carolina, right, but in the U.S., like have a patient that comes and says, hey, I'm having suicidal ideations, or, hey, I, just attempted suicide. We would be required by law then to report them to law enforcement and not be able to provide adequate mental health treatment. You see what I'm saying? And again, I don't practice in no other country. I just practice in the state of North Carolina, but just reading over that, and that's just from the international, it's an international statistic, International Foundation of Suicide or something of that sort. But that's really clinically.
Sure.
That's really important to remember. Different countries all over the world, each country or each individual region, it could even be a district in a certain part of a country, they have different behaviors in their culture to somehow relate to that. And it can be either a positive or a negative thing. The acknowledgement of each culture being different is it's a deepening subject of finding the resources in that region to positively help other people. It's kind of it makes the ideation of it being a real global epidemic that needs to be addressed forefront in the right front and center of your mind or your eyes. You can look at the way people behave. Do you have the necessary skills through your own understanding to understand the culture that they live in, whether it be the spiritual foundation or just a traditional foundation, to be able to go through it? It just opens up another wide variety of the necessary requirement to be able to understand different cultures. So important. It can be overwhelming, but individual spot of the world needs to step up to help these people of their own kind or of not their own kind, who may be hurting in such a way where they might try to take their own life. A very vast amount of information that we're barely scratching the surface of, again, in this One Moment podcast.
No, and which you bring up a lot, and I think, I want Ruben to kick us off with this, but we were talking a lot about some of the risk factors last night, and so I think those are interesting, especially some of that, the information that we were reading about, man. If you could start us off with your list, and I'll finish it out with
just one thing. It was the overview. It says suicide is the leading cause of death in the United States. suicide was responsible for over what Kevin said earlier, 48,000 deaths in 2021, which is approximately one suicide every 11 minutes. And I thought this was interesting. It says in the past 2 decades, suicide rates have been consistently higher in rural America than urban America. Between 2000 and 2020, suicide rates increased 46% in non-metro areas compared to 27.3% in metro areas. It says white non-Hispanic people have the highest suicide rates in urban areas, while non-Hispanic American, Indian, and Native people have the highest rate in rural areas. Rural residents have 1.5 times higher rate of emergency room departments visits for non-fatal self-harm than urban residents. And that caught my attention because the clinic that I work in as a substance abuse counselor, we provide treatment for a lot of people who live in rural communities. And I can say that since I've been here, they can't say how many. I've known personally a few patients that died by suicide. You just try to put yourself in that person's place, and people say, don't they think about their family and all like that? I imagine, when I was going through a bout of depression, anxiety, I know I wasn't thinking about suicide, but at the same time, I know I didn't want to go on like that. And Trevor mentioned cultural. I know, and not that I used to hear this when I was a kid growing up in the Baptist church, and people used to say that in the culture. I'm not saying I'm not. Black people are not monolithic. They range and all that. But I used to hear a lot of times people say that if you die by suicide, they used to say commit. If you commit suicide, you don't have a chance of going to heaven. And that stayed in my mind. Well, as a teenager, I want to go to heaven. So that was never an option. I think culturally, over the years, I learned that, what, I don't necessarily say I buy into that. I'm not a biblical scholar, but I know the God that I serve and love is a loving God. I can't say that I believe that now. I'm not going to even get into that, that if a person dies with suicide, oh, they're doomed to hell. I don't want to get into that. I'm not going to say I believe that, but I think in the beginning that what kept me from even considering that. Growing up in that, if you die by suicide, you can't go to heaven. You know what I mean? So a lot of cultural impact, things people believe culturally, within their communities has an impact as well. You know what I mean?
Yeah, and you are right. And, there are many risk factors. You mentioned living in urban areas and different things like that. And so I want to go over some of, I'm going to read off a list of different things that increases the risk, right? Some of the risk factors include, so broken down into various categories. Socio-demographic is going to be Alaska Native, LGBTQ population, history of incarceration is what you were talking about earlier, Ruben. Non-Hispanic white, if you are a male versus a female. If you are a migrant or refugee in a new country or a new location. If you are of older age. Clinically, you have, again, we've already addressed some of the other risk factors such as alcoholism, drug addiction. We also mentioned social isolation or, environmental isolation. If you have any type of mental health diagnosis or diagnoses, problems related to self-esteem or self-hate or such as self-hate. And then, of course, now nobody from the little bit of research that we were doing yesterday, I added to it on this list as far as being medication induced. Some medications do increase the risk of suicide. And I'm not a medical person, so I'm not going to get into what the medication that I was taking caused, the name of it, but it is. There's a provider about that, your medical provider. Family history of suicide.
Yes.
That is another big one. Then you also have I think this is the last domain for risk factors, but it's adverse life events, child abuse, loss of employment, loss of relationships, financial stressors, chronic stressors, and these could be with oneself, friends, or family, could be medical complications, poor problem-solving skills, experiencing violence in childhood or adolescence, sexual abuse. I mean, and again, this is just not a complete list. This is there's so many more things that we didn't even talk about as far as being a risk factor.
Kevin, you said one thing you did. I think they said another risk factor is older than 65 years of age. I'll be 69 in April, and I can see where that, because oftentimes when you're a senior citizen, and if you live long enough, unfortunately, you might outlive your spouse and you're left alone. Oftentimes, a lot of your friends might have passed on or moved on to a nursing facility or what have you. I think for me, for example, it might, I'm a friendly person and jovial, but I think when you're oftentimes when you're a person of elderly, because of health problems, you might be isolated and you might not have that healthy social environment, or that those friends that to talk to or to work through problems. Oftentimes, when you're elderly, you have chronic illness. I know I might look good and healthy, but at the same time, I always say that, for myself, about 4 years ago, I had a right hip replacement. I came through it. Talking about so many ailments, I'll share. About 4 years ago, I had an aneurysm on my aorta that thankfully didn't rupture. They found it and they did surgery for it. I've had surgery on my neck. I had hardware put on my neck, and probably sometime by the end of the year, I'll probably have my left hip done. But I still gonna be dancing on videos and stuff like that, having a good time. But I've been through a lot. But I think being a counselor has really helped me over 25 years. The old saying, physician heal thyself. When I'm talking to patients and listening to patients, and I think a lot of those things, that coping skills, I internalize those too. So it helped me to through my life. My wife and I, we've been married 45 years, and I couldn't imagine if something was to happen to her, how my life would drastically change. And she jokes and says, well, Ruben, I would want you to get married again. But I always say, you know what? It wouldn't be that easy. And I think lots of times when you've been with a person so many years, that can be scary, that when you're a senior, I mean, it can happen at any age, but especially when you're a senior citizen, your partner passes away and maybe your friends are limited because you're not as mobile. I live in a 55 plus community, golf course and everything. And, it's a nice community, but over the last 12 years I've been living there, a lot of my neighbors, I just met one yesterday who said to me, Ruben, I'm moving away to Charlotte in an assisted living facility. My next door, another neighbor moved away to be with her daughter in assisted living. Some of my neighbors have passed away. They jokingly said, Ruben, after a while, you'll be the only original person on this block because new people are moving in. But that's unfortunate when you live in a 55 plus community. I've seen a lot of my neighbors die or go to nursing homes and pass on. And, that could easily happen to myself as well. So I can understand being a senior and having chronic illness and, and being in despair, and your life changes. And if you don't have that social network, not even a network, but a few close friends, that's important. That's why I value Kevin and Trevor. I think I always say, I joke with Kevin, but I think Kevin, if something was to happen, he would be there for me. I know that. Wouldn't you, Kevin?
No, I don't like you. Look, Trev is cooler than you. I'm just picking. I got your back.
Yeah, but that's what I'm saying. With being a senior, I know that can be a challenging years for you. Thankfully, I do have my health, and the health problems that I had, I have recovered. But that's why I'm more focused on my health and my mental health and my spiritual health more so than ever. You know what I mean? I could see it. They said that they would come up rise in suicide amongst seniors is growing. That's they said compared to suicide deaths rose to 8.1% among people aged 65 and over in 2001. That's quite a big rise. Sure.
Well, listen,
Trev.
Trev.
Let's kind of flip the script on that. What if you're between the ages of 6 and 16.
Yes.
What kind of statistics is it for those types of young people, the adolescents?
I was shocked when I don't know the statistic, maybe Kevin can look it up, but I was shocked when I heard that suicide amongst adolescents and teenagers, because, the premise is, I know when I was a kid, what you have to be worried about, go outside and play, what you have to be worried about, but, you
So,
experience feelings and emotions as well.
Exactly.
I
And
have
they're
a statistic.
developed yet into the full understanding of their emotions to begin with at a young age. And I imagine that those types of behaviors could readily jump in if that's the way that they're deeming their only answer to get out of the problems that they're in, which really must be specialized in the sense to having the categorized methods to help them along to recover from this thing. So I'm kind of curious what, as far as our young generations are doing or how it's affecting them.
So I have the statistic pulled up. I'm going to read off to you the global, and then I'm going to move to the U.S.
Okay.
According to the latest World Health Organization mortality database, the mean suicide rate for adolescents aged 15 to 19 was 7.4 per 100,000 in the latest year, with higher rates among males, 10.5, than females, 4.1, in almost all countries. However, between 2000 and 2018, the suicide rate among youth ages 10 to 24 rose from 6.8 per 100,000 to 10.7 per 100,000, pushing suicide into the second leading cause of death for people ages 10 to 14 in 2021. High school students seriously considering attempting suicide in 2023, and suicide deaths among 10 to 24-year-olds increasing by 62% from 2007 to 2021. Now, in the United States, according to the latest data, suicide rates for teenagers in the U.S. have fluctuated over the years. In 2022, the suicide rate for adolescents aged 10 to 14 was 1.9 for females and 2.8 for males, while the age group 15 to 24, the rates were 5.8 for females and 21.1 for males. These rates indicate that males have a significantly higher risk of suicide compared to females in these age groups. Additionally, the suicide rate among young adults aged 25 to 44 was 7.9 for females and 29.6 for males.
20%. Oh my God, almost 27%.
Yeah. So those are some statistics which are very disturbing, as you said. But the neat thing about this is there are some protective factors, and there's many protective factors. So, but before we get started on the protective factors, we got something for our sponsor, WebHash. Definitely wanting to play their advertisement.
An era driven by digital change.
So, what?
That's a great advertisement. I like that.
Yeah, I like all of them so far. We got about 2 or 3 more we're putting together. So this is for amongst us and to the audience. Yeah, we got about 2 or 3 more we're going to be putting together.
We talk about something serious topic, but I'm a jovial person. I want my own, commercial too, dude,
Ruben, there's that ego of yours, okay? So
my wife about it.
I love you, dude, but that's your ego, okay?
Right.
Go ahead.
Something was mentioned in the ad about the word legacy, and it helped bring this serious subject back into the forefront of my mind. And people, whether they're young or old, they don't seem to be able to determine or be able to recognize what type of a legacy, removing themselves from life's equation and giving it up. What kind of a legacy is that going to leave to their loved ones, their friends, their colleagues, their relationships that they've built, and the people that are seeing them struggle through issues that every one of us has to deal with. And it can be anything. You never know what situation is going to affect another person differently than you. So being able to recognize the symptomatic things that can help you understand it better are really important, because on the word legacy, what kind of legacy is that going to leave behind for the people that are left behind? So it was kind of neat to hear the word legacy and see how that plays into our actual discussion.
I don't
No.
think that's one thing about a podcast we could agree and to act. I don't think at the time that when that person dies, but if they're successful, use that word, dying by suicide, they don't think about at that moment. They don't think about the people I've talked to or worked with who attempted suicide, who survived. Talk about they weren't thinking that they were so much in so much despair and hopelessness, and especially with drugs and fentanyl being in the mix, that they weren't thinking about the legacy of what I just want out right now. I'm not thinking about, my mother, my sister, my brother. I'm just thinking about I want out. I don't want to die, but I don't want to live with this pain. And a lot of people say that. I know. Again, when I shared my experience, I didn't consider suicide, but I know something told me, Ruben, you're gonna work through this. Just hang in there. It's gonna get better. And each time I went through those bouts with anxiety, that kept me going. That inner voice, that mantra that I say, you know what, Ruben, you're gonna work through it. You had physical things you worked through in the hospital, surviving an aneurysm. You're gonna work through this. It's gonna get better. And like I said, each time I worked through it, it got better. But I didn't think about the time my wife or my daughter or my grandkids, I just didn't want to feel that depression. I didn't want to go to sleep because I knew I wouldn't be able to sleep. I just didn't care about that. Looking back in retrospect, yes, I do. But at the moment, I was in so much pain and going through anxiety and feeling the hopelessness. Why did I move back to North Carolina? That I just didn't think about that at the time. My legacy, what would legacy be? I didn't think about that.
Well, see, as you were talking, right, and you using that word, legacy, and what you were sharing, first person that came to my mind, and in a sense, you're right, but I want to build on that part. Okay, I disagree with the fact that they're able to think about that for a moment, right? That they're thinking about the legacy. But what I mean by, so I'm like Ruben, I agree and I disagree, right? But when I look at research, right, so many things come into play that when we think about Eric Erickson and his psychosocial stages of change, stage 8 says integrity versus despair. In late adulthood, ages 65 and older, individuals reflect on their lives and assess their accomplishments. Success leads to a sense of integrity and satisfaction, while failure can result in feelings of despair and regret. And part of that sense of reflection, right, I do think goes back to being able to, have a sense of accomplishment, have a sense of, content or contentment. So I think what you were saying really makes sense, but I think, there's more to it there. And then when we look at the younger age, and this is I know we're pushing time here, folks, this is a topic that we can have many, many more discussions on, because there's many reasons why teenagers do it, right? Some of that could be bullying. Some of it could be social. Ruben, fix yourself over there, son.
I had to plug it in. I'm sorry.
Okay, fix yourself, dude.
Adjust myself. Okay.
Yes.
Adjustment. My phone. I'm on my cell phone and it's dying. And that's why. Okay.
Okay, well, dude.
Okay.
All right. Are we good now?
Yes.
Okay. Lord have mercy. You and Trevor.
That's why I said we grow doing podcasts.
You and Trevor with these. Trevor's losing it over there. He can't keep it together. He's laughing. Oh my God. Lord have mercy. Jeez. Lord have mercy. Trevor.
No, my phone was 17%, and I knew it was going to die because it dies quickly. So I get in.
That's all we can expect from you.
Listen, Ruben, for now, listen, moving forward, okay, plug the phone up and keep it somewhere.
Okay.
Okay, and hurry up and get that laptop.
A laptop, for this.
I think what you're probably expecting me to do is buy the laptop for you, honey, right?
Yes, sweetheart.
No, but for real though, getting back to the seriousness, right? Lord have mercy. That's the cool thing about running the podcast, right? We get to be ourselves.
Mm-hmm.
But there's so many protective factors, and I want to hit on those. I want to talk about those. I want to emphasize that, right? And some of those are personal environmental characteristics that help individuals and protect them from suicidal thoughts and behaviors. Some of those could be problem solving, having a reason for living. So like I say, Trevor, you were right? But there was pieces that you were missing.
Now,
Having family.
What did you call them? Protective what?
Protective factors. Yeah. Having family, friends, and or pets as a reason for living, having emotional regulation, even having a sense of cultural identity, or even a sense of oneself. That's a protective factor. Having psychological resilience, feelings of hope, being or feeling connected or support from one another, having a strong community or sense of community, reduced access to lethal means, medication management from others, changing of one's environment, access to religious institutions, moral objections to suicide, supportive healthcare providers. And I'm going to touch on that real quick when we get done. Access to healthcare or integrative healthcare. And there's so many other ones. There's so many others that I'm not even going to finish the list off. But when we talk about
access to medical care really is an important thing, because what about those that have access to nothing but themselves?
Well, you're right. And I think this is the part that we're missing in the healthcare field, right? From what I've seen and from what even I've supervised, a lot of people, I think there's, when we read that statistic, over 20% of people don't tell their healthcare provider that they are having suicidal ideations or suicidal thoughts. There's reasons for that, right? One of them could be they don't feel comfortable in that environment or in that relationship. One of them could be fear of being judged, fear of being forced to take medication, fear of being IVC'd or involuntarily committed. And then also from a therapeutic perspective, where in the beginning, if I was 2 days out of grad school with my associate level license, I'm not going to feel comfortable talking about suicide and working with that. But today I do, right? So we look at clinical competence, right? And I think that's a huge piece. Working with the patients who are suicidal is a risk factor, right? It's a huge professional risk, a lot of risk going to that. They're a high risk population, right? And, this is one thing that, I would like to stress. We mentioned a lot of good things, from having those thoughts to having those behaviors, from the risk factors to the protective factors. I've always stressed that based on circumstances, based on situations, based on a lot of things, based on a number of factors, if I'm having suicidal thoughts, right, I always practice from the idea of, hey, that's absolutely okay to have a thought of harming myself, right? Absolutely 100% okay. We're biologically wired to think. We're biologically wired to think. That's like basically saying, oh, you're not supposed to feel, or you're not supposed to think about drinking. If a person's in recovery from alcohol use or drug use, they're going to think about using and drinking, right? It's normal, right? So I want to challenge any person, any professional watching this, normalize those thought processes, right? But also I want to emphasize the most critical piece of it. It's the actions that we take, both as persons who have struggled or are struggling with it, and also the actions of the provider. Those are two. And so that's I think is important. It's one thing to think about it, but it's the actions that matter.
Right.
The actions that are critical and that are the most important on both sides.
Sure. A therapist or a counselor has to model that behavior. I think oftentimes when I do groups, patients oftentimes test to see what the counselor is comfortable talking about. So when somebody brings that up, I don't get, oh my God, they're talking about suicide. I gotta, I address it. I get them help. Well, I used to work in a hospital-based clinic. When that came up, we would personally walk the person. I get a security guard if they were erratic behavior, but we would personally walk the person to the emergency room at the hospital. And then a psychiatrist would come down from the behavioral care unit and or a mental health provider and talk to that person to determine if they need care. So we will remain with that person until they're triaged. And once they're triaged and actually in the emergency room but being seen, then we would leave that person. And then, so they would think it was a process, it was a therapeutic process, and to get that person help. But some of the patients initially were angry, like when that happened. I remember I had one patient was angry because he because he had to be hospitalized, but in the long run, he appreciated that, so I agree. The counselor, the therapist has to be comfortable. When I first started a counselor 25 years ago, when a person mentioned suicide, I was like, oh my God, they're talking about suicide. I don't do that now. I listen, I check in, I ask them.
And I'm the same way. When somebody mentions, they're having suicidal ideations or suicidal thoughts, or even if they had a recent suicidal attempt, I'm like you, in the beginning, I was nervous. I was scared. I was not competent at all. But today, I'm like you. I sit there and listen. I give empathy. I give compassion, all of those things. Because that's what's important. It's about building and maintaining that trust with the people that we serve. And even as a corrections officer, right? It's
Sure.
about, it's not just about, having people in your prison system, but it's still about building and maintaining trust with the people that you are serving, because you're really a servant.
There has to be of environmental, emotional. So the more you encourage the environment involvement, what Ruben was just discussing, to me, put a little focus on how important it is to have a positive reinforcement of a good, stable environment around. And how do you do that that's very difficult to do, because
Yeah, I can imagine. Yeah.
sure, you're secure, but your environment may not necessarily be a positive place for you to be able to maintain your mental health stability in the sense of the actual environment that you're having to deal with. So it's really critical to make sure that a consistent,
He disappeared
ongoing
like a magician.
regimen
He'll be
of
back though.
training with
Just
this,
bear with us, audience. This happens in podcast.
even on
We're
the
learning
ground
and
level,
growing.
because they do
I think
have
that what makes it kind
professionals.
of like,
Oh boy,
he's gone. Okay.
I'm not sure what happened. Do we just get cut off?
Can't hear you, Kevin.
All three of us are
Are y'all
having
still
tech
there?
issues, brother. Like, I don't know what happened on that one, but it is what it is. Listen, we got to do a hard wrap up. But
Okay.
if
I
you
wanted
need
to
help,
mention one thing. Can I mention?
go
You're
ahead.
talking about young people. When I lived in New York, I remember this case and I Googled it, and it touched me because I said, in that person's mind that they thought they had to resort to suicide. He died September 22nd, 2010. It was in the news. It was a national news, and it talked about, and it was a trying case. He was an American student at Rutgers University. He jumped to his death from the George Washington Bridge over the Hudson River on September 22nd, 2010. And it's because on September 19th, 2010, he was a gay individual. His roommate took a webcam and videotaped him having a relationship, kissing another man. And they say that they showed this video throughout to certain people at the school. I remember it was on the news. It was a big case, and he ended up dying by suicide. I guess he felt no other recourse, despair, and it was talking about. It made such national news because they was wondering, could they convict these two people? There was another person involved in the filming, and they were saying, could they convict these two people or charge them as accessories? Because, and the lawyer, the other person's lawyer was saying, well, they're not responsible for what the outcome of that. So that was a big case, and that just touched me because I said, for a person to go through that and then to feel no other recourse for that. Me and my wife was talking, and she said, well, Ruben, how would you feel? I said, well, if I were gay, and I said that, and somebody filmed me at 18, maybe I would feel that way. But at 20-some, at 60-something years old, yeah, it would probably be embarrassing, but I think it wouldn't be the point where, oh God, I'm gonna take my life. I think at 69 years old, I'm a different person. I wouldn't think that would be something I would take my life, but I have protective factors. I'm just saying, at 18, there's peer pressure, there's cyberbullying, so that's different. I'm not minimizing that, young man. I think as you get older, I think that would probably be embarrassing, but I don't think it would cause me to take my life. You know what I'm saying? I ever want to wrap up, and I'm usually the one that say, gotta go. I'm rushing, but this time Kevin's rushing, but I know we gotta wrap up, but that's the important
No,
part.
I mean,
So,
dude, like, I don't have to wrap up, but typically we push an hour and a half
yeah.
max. And so we're already at an hour and 25 minutes. So it's not that I'm trying to rush.
Well, I usually rush because my wife, I know she cooks dinner
whatever,
around about 4 o'clock, but I
whatever.
told her, don't worry about dinner today. Don't
So
worry
you
about
want
it.
to go
I'm
on for
still
another
here.
hour then, honey? I mean, we can
Yes,
go on for another hour.
but mentioning social media, I know the impact it could have, like to the point where you check your social media and see how many likes you have and all like that. And I think I didn't get on social media till about 6 or 7 years ago. And I think I'm glad that I got on social media at the age in my 60s, because if I was a teenager and driven by peer pressure and wanted to be liked and fit into a group, I might be influenced by that. With this podcast, I always say if we reach one person, that's great. I'm not, my ego isn't based upon, Kevin has a big ego, but it's not based upon social media. It's not based upon that. So I'm glad that I'm wiser and that social media wasn't around when I was a teenager, because I might have been influenced by it. At this point in my life, if I only get one like on my social media, I'm not driven. Oh my God, what's wrong with me? Why people don't like me? I'm not driven by that anymore. I might have been in the past of my teens.
Well, listen, Trevor, we got to get you a computer. Ruben, we got to get you a computer, because we just do. So, as always, folks, we're going to end the live and then we're going to do a debrief. That's and this is for all the audience to see, so I'm not even worried about it. I'll edit this piece out later on. But listen, as always,
one point I want to make too, I forgot to mention, we talk about resilient and all, and I'll shut up. If you can see me on the side of my head, on the side of my head, my left side, my left side of my head,
I'm going to edit all this stuff out, okay? Just so you know, I'm editing it all out. We're live right now, but it's going to be edited. Go ahead.
I have a phoenix on my head, and I didn't get it because it looks good. I got it because it reminds me that, you know what, no matter what I go through, I can always come through it. You know what I mean? So I have a phoenix tattoo on the side of on my left side of my head, and that's and my emblem for Live and Thrive. My logo is a phoenix, because I'm always believing I can rise above it, and be stronger.
Okay,
I have a
listen,
phoenix on the
folks,
side of my head.
Folks, listen, family. Okay, listen, hold on. Let's wrap.
Can you see it? Yeah. Yes.
Oh my God.
And don't edit it out, Kevin. Do not edit it out. I'm serious. You saw it? Yes. Do not edit it out, Kevin. I'm serious. Okay.
I don't know you two. Listen, if you need help, okay, if you stay in the U.S. Or any type of territory that related to the international numbers here or the national numbers here, 988 is the number to the National Suicide and Crisis Hotline. Please dial that. Again, 988. Also, 911 is, please dial 911 if you need assistance from if it's a medical emergency. You can also go to a local emergency department or crisis center. Please, again, 988 is the National Suicide and Crisis Hotline. 911 for the local emergency services. And, of course, you can go to a local emergency department or crisis center.
And a person who has a problem with addiction, there's a place called Never Use Alone. It's 877-69199. And their goal is to keep you safe while you're using. They believe in harm reduction. There's no judgment. People say, but they're encouraging use. But no, they're with you while you're using. They're promoting harm reduction. And that's, again, Never Use Alone. That's 877-696-1996. I'm done.